At the Halley Consulting Group, our hospital and health system clients frequently ask us, what are the potential advantages and disadvantages of the work relative value unit approach in hospital-owned medical practices? This question will be answered by Will Reiser, who is the Chief Information Officer at Halley Consulting Group. Will is also our content expert in the area of physician productivity compensation models. Let's hear from Will now.
I think that there are a couple key advantages of RVUs, and I think one of the primary advantages with Work RVUs is that they provide that direct measure of the work effort that the physician provides. This can ultimately provide a precisely targeted metric upon which to base the compensation. The physician, through appropriate coding and documentation, can control the ultimate compensation level. RVUs also flex with the complexity of patients and so on, and so it really does help to just target in on that direct effort that the provider happens to provide. Also, while it may not necessarily be realized by most providers, I think most administrators understand that many payers structure their reimbursement for billed charges based upon an RVU scale. So when you compensate physicians based upon the Work RVUs, there is a degree of alignment between services rendered and billed and the compensation paid, again, as long as you ensure that those rates per unit are appropriate and not exorbitant. But RVUs aren't all rosy either. There are some challenges. Basing compensation on Work RVUs can require some degree of creativity when you're dealing with specialties or practices which have a high cash-based component to the services. For example, some cosmetic procedures may not have RVUs associated with them, and so there may need to be some creative methods to deal with that type of a service mix. And also, I think it's very important that special care be taken when you're dealing with surgical specialties to ensure that the billing system will appropriately adjust the accumulated Work RVU values assigned when multiple procedures are performed. Medicare and other payers will frequently reduce the reimbursement for the second and third surgical procedure performed as part of the same surgical case. And if you fail to appropriately adjust the Work RVUs for those cases with multiple procedures, you can result in an overstating of the Work RVUs, and that, of course, would then lead to an excessive compensation.
Thank you, Will. For more information on how you can use the Work Relative Value Unit approach in your hospital-owned medical practices, please call us at 614-899-7325.